Hi, thank you for tuning in to another Fast Facts Friday. I'm Josh Droppelman, your patient experience coordinator. We're here today with Dr. Carmona to discuss some screening, prevention, and treatment of cervical cancer. Thank you for joining us today, Dr. Carmona.
Thank you.
Can you tell us a little bit about yourself, your specialty, and how long you've been with Fairmont?
Yeah, sure. I came to Fairmont this last summer of 2018, and I was recruited to serve the patient population here in obstetrics and gynecology. So we care for all aspects of women's health, anything related or most issues related to breast and obviously reproduction, infertility, ovarian problems, contraception, sexually transmitted diseases. We cover pretty much any female issues. And if we can't take care of it, we'll find the right person who can. Yeah.
Great. Dr. Carmona, can you tell us a little bit about cervical cancer and cervical health?
Well, cervical cancer is actually one of the more common and treatable cancers of the female cancers. Currently, we see about 13,000 cases a year, if not a little bit more than that, of precancerous changes. And we have in the United States more than 4,000 cervical cancer deaths every year. And usually we can prevent it. Cervical cancer can be prevented if we catch it in its early stages with screening.
Perfect. And how is a Pap test vital to the diagnosis of cervical cancer?
Well, Pap Smear is not a diagnostic test. It's a screening test that we use to help us identify who may be at risk for developing cervical cancer. It used to be about 20 years ago that all we had was a Pap smear, but more recently, probably in the last 15 years, and about 20 years ago, we started seeing a link between abnormal Pap smears, cervical cancer, and a sexually transmitted virus called the human papillomavirus. And as we started seeing this link, we realized that when we pair the Pap smear and the HPV testing, we can start to identify patients who are truly at risk for developing cervical cancer.
Okay. Recently, the Pap smear test guidelines have changed. What changed about them?
What changed is that when they looked at the pairing of Pap smears with HPV testing, we found that it was a much more sensitive test at identifying patients who were at risk. And we, in addition, learned that very young patients, specifically patients under the age of 21, almost never, it would be exceedingly rare for them to develop cervical cancer. And so the guidelines changed so that we don't start screening patients until they hit age 21. And then we found and we knew that once somebody becomes infected with the HPV virus, the process of turning into some precancerous changes doesn't happen over months. Usually the process of developing precancerous changes occurs through several years, and full-blown cancer really takes, from the time someone gets infected till the time they develop full-blown cancer, is typically in the neighborhood of 5 to 10 years. So initially we were doing Pap smears just by the Pap smear by itself every year, but when we added HPV and identified the patients truly at risk, we realized that we could space out the Pap smears to every 3 to 5 years, depending on patients' risk factors for people who had not had any precancerous problems in the past. And we weren't failing to identify patients who were at high risk for developing cancer and treating them before they developed cancer if we screened them every 5 years, as long as they had a negative history. So it was more cost effective, and it also prevented us from doing a lot of invasive procedures, which nobody likes to see a gynecologist, let alone go in and have a procedure done. So it let us not be so aggressive at putting patients through procedures that really weren't yielding what we were really trying to prevent, and the prevention was trying to prevent cervical cancer.
Okay. You said that they start testing at an early age. Is there a time where they can stop getting a Pap smear test done?
As a general rule, we stop testing at age 65. With a couple of exceptions, and this is something that patients really don't understand. Patients assume that after they've had a hysterectomy, they don't need Pap smears. And that is only true in patients who have never had abnormal Pap smears. So in patients who have had abnormal Pap smears, even if they have a hysterectomy, they still need to be followed because they can develop cancer of the vagina. Although much less rare than cervical cancer, it certainly doesn't eliminate that possibility. And the guidelines tell us that once somebody has had moderate to severe precancerous changes, then we need to follow them for a total of 20 years after they had those abnormalities. So say, for example, somebody at age 50, we identified that they had moderate to severe precancerous changes, and it finally resolves at age 52, they don't get to stop doing Pap smears at age 65. We have to follow them out till age 72 because there's always the chance that the virus, which accounts for over 98% of cervical cancer, is asleep and dormant in somebody's body and can be reactivated and cause precancerous or full-blown cancerous changes.
Okay. So if precancerous changes was found, what can a patient do to keep them from progressing? Is there anything that they can...
Well, there's multiple things. I mean, once it's found, there are specific things that you can do and try to prevent to boost your immune system. The bottom line is that with precancerous changes, I can go in there and I can remove or destroy the areas that are abnormal. But what I cannot do is get rid of the virus that seems to drive the precancerous changes or full-blown cancer. And so the specific things I tell my patients are, you have to try to help your immune system be at its best or be as strong as possible. So I ask patients to take a multivitamin every day, get at least 6 to 8 hours of sleep every night because that's when your body's healing itself. Eat a balanced diet. And if you are not in a permanent relationship, you have to use condoms because the more viruses, the more strains of the HPV you get exposed to, the more other sexually transmitted diseases you get exposed to, these things compromise your immune system and can also speed up the disease process. So those are things that you need to try to do. On the side of things that you should be trying to prevent, for some reason, and we really don't understand why, but cigarette smoking in combination with the HPV virus tends to accelerate the process. And cigarette smoking, we know the carcinogens attack the mouth, the throat, the tonsils, and for some reason, and we don't understand, it also attacks the cervix. So that's very important, and we find that probably some of the patients that have the hardest time clearing the virus from their immune system are patients who smoke regularly and are not able to quit. Using steroids for prolonged periods of time, even if it's an inhaler, can also compromise or suppress your immune system. Any chronic illness or long-term stress is also going to compromise your immune system. Let me think of what else. There is one other thing. Excess drinking. You're allowed to drink, but binge drinking or drinking excess on a regular basis is going to compromise your whole health in general. And then there are other things that seem to be risk factors, like exposure to DES. There actually recently has been shown that there seems to be a genetic predisposition in certain families to not clear the virus, and it actually seems to there seems to be a correlation in certain families for the virus. Let me think of what else. Multiple sex partners, obviously, the more STDs you get exposed to, the more the chances are that you're going to be exposed to this. Having children at a very young age or having more than 3 children in a lifetime can increase the risk of cervical cancer as well. And some new information that is relatively new is that use of oral contraceptive pills tends to increase that risk, but it's not long term. So once somebody comes off birth control pills, their risk of cervical cancer starts going down, and by 10 years after discontinuing a birth control pill, that risk goes back down to normal to the rest of the population.
Great. If there's one thing you can leave our viewers with to remember about cervical cancer, what would it be?
What I would tell patients is that you've got to get seen regularly. And I know how hard it is once moms have children and, you're at the bottom of the list of whoever needs to be taken care of. But really, when we find cervical cancer, and I've never seen it otherwise, and I've been practicing for 22 years, it is always in somebody who has not seen a gynecologist in the last 5 years. So the best way to prevent it is see your gynecologist regularly and find out what your specific guidelines should be. If you've never had any abnormal Pap smears, then you don't need to be followed as closely. But let your gynecologist look through your particular records and decide, what's appropriate for you. And certainly if you've had a history of abnormal Pap smears, then definitely you can't just forget about it, even though it is a slow-growing virus and a slow-growing disease. The worst thing is to ignore it, because that's when it gets ignored, that's when we have patients coming in and find that, they've progressed to full-blown cancer. So prevention is, and this is very, very, very preventable, but prevention is key.
Great. Like Dr. Carmona said, routine screening is the key. I'd like to thank Dr. Carmona for spending some time with us to educate us on cervical health. Stay tuned next week for another Fast Facts Friday.